Ooh.
If I talk from here, can they hear me?
Good morning, everyone. Dr. Rob Kiltz and Dr. Faez Faruqi.
Good morning.
Hello. Kindness, and I think, let's see here. Drew Brains, JJ Patterson. Hello. Stacy's.
Monica, Nelly.
Paul, Dr. Mags, how you doing?
Wow, Dr. Machiavelli's there.
And Becky Ann, good morning. It's a pleasure to be on today. What is it, 23rd, Memorial Weekend? Oh, so summer is upon us, coming soon. And welcome here to share some thoughts and ideas, answer your questions.
That's a nice thing.
Bunny.
Vacancy.boom.
Underscore
available.
All right. Bunny, hello, Amber, Takesha, Sarah Marie. Let's see, transfer tomorrow. All right. We're there tomorrow. Dr. Faruqi may even be there tomorrow. I don't know. But I'm there tomorrow with Dr. Corley for sure and Dr. Condrup. And we're welcoming Dr. Condrup to the team. And Sarasota is going to be opening within the next few months, monitoring. And hopefully by the end of the year, we'll be doing retrievals and transfers. Excited about it.
Happy Sunday, Patterson, JJ Patterson.
Building families, Saibo, Melissa, Safel, what day should you have sex once you get positive ovulation at home? At least the day of and the day after, and maybe the day after that. And
the day before.
Well, but once you get ovulation, for sure. But if you're having intercourse at least every other day, you should catch the window, right?
Yeah.
Right.
Actually, do you even recommend to your patients to do ovulation testing if you're just doing intercourse?
You don't need to, but it's women like to do it, and temperature taking, and certainly keeping an eye on knowing if you get the ovulation surge. But if it's not working, that's where maybe trigger shot and IUI can be added to that.
I wouldn't do it every month. I just do it a month or two just to make sure it's happening, and then I just go the.
But many people like to keep it on an app and monitor these things. It can be very, very Shane, hello. And Melissa, Becky Ann, let's see, Atlanta, Makisha, how are you doing today? Walters Rogan, Ann King, hello, Ann King Thrower, how are you? And to Alan Thrower, thank you for all the hard, amazing work you do for all of us.
Oh, Alan's there too today.
Let's see here. Can you talk about, how about this one? Worth it at the end. Let's see. Can you talk about what I can do to make sure my transfer doesn't hurt and my uterus doesn't contract? It happened my first time.
Well, if you're feeling contractions, just tell us. And usually they only last maybe a minute. We could just wait and let it pass, and then we can do it right after that. I'm not even sure that there's any strong evidence that changes pregnancy rates. We just don't like doing the transfer while you're having pain and the contraction. So we could wait it out. Make
sure you ask for some Valium. We often use a little Valium. And for some people, even IV sedation for their transfer, it can be very painful for some. So we want to make sure that the things that you need, we're able to do that for sure. Maria Cruz, hello. I began to estimate the 9200 gonal F28 CG in the first sonography. I had 9 follicles on Friday. They increased 300 of gonal. My follicle grew, then 19. Cancel for follicle that did not grow enough. They only came 11. Maria Cruz, we'll have to look at that. I usually do start the dose, stay on the dose. I don't go up or down very often.
Neither do I.
And once the follicle is 16 to 18 millimeters, I think it's triggerable. Sometimes even you would go 18 to 20 millimeters if we want the smaller ones to come. Hello, Donna. How you doing?
Hi, Donna. Hey, that's a good question over there. What's the success rate of tubal reversal?
60 to 80% is the number I quote, depending on the type of tubal ligation.
So can you tell us about different types?
Well, whether you had it cauterized or clipped or banded, if they remove the tube, it's no good, or they remove the fimbriae, it's no good. But quite often you don't even know what was done because a lot of things happen after the fact. And so the only way to know is to do a laparoscopy and go in and do it.
Yeah. The other factor that plays a lot, other than the technique, is the age of the patient.
Age, AMH, but we've had 42-year-olds do a reversal and get pregnant and have a baby.
Yeah, because when you do a reversal, you're literally trying every month. When you're doing IVF or treatments like that, it's only that month that you have a chance. All the other months, you have no chance.
Yeah. Embryo, let's see, natural killer cells kill the embryo. Is this true? Bridget Toffoli. So natural killer cells are evidence of inflammation. Whatever's causing the inflammation signals all these white blood cells to come in, which then has an adverse effect on the endometrium, the lining, and ultimately may damage the embryo and prevent implantation or cause a miscarriage.
Yeah. Now, it's a relatively new concept, the immune therapy and the immune, let's say the immune chapter in fertility. There's still many people that question it, but both of us believe that it's definitely there.
Alan Beer, 30 years ago was, and even before that in some way, but it's one of those things, as Dr. Faruqi said, so many people don't believe it, but the foundation of all disease is inflammation, and infertility is just another disease, unfortunately.
Yeah.
Kindness and rainbows. Have you heard of benefits of hyperbaric oxygen? Yes, I think hyperbaric oxygen can be beneficial because much of the damage and disease in our bodies at the cellular level is due to hypoxic environment, meaning that microvascular damage reduces oxygen. Reduced oxygen reduces the normal metabolic process, which can absolutely damage the cells, the eggs, the sperm, the embryos, and the implantation. So hyperbaric oxygen may be helpful.
But you have a word of caution. Too much oxygen will also cause oxidative stress to your eggs and to your sperm. When babies are born, newborn babies, and we give them too much oxygen, it causes blindness for them. And so you just have to have it at the right amount. If you're hypoxic, yes. If you have normal oxygen levels, putting extra oxygen, not 100% sure.
Let's see.
Dhanraj Kumar.
Let's see. We'll get normal sex time. Anytime, really. I think we think too much about it, and it really isn't supposed to be so timed. Be a lot more open to letting it happen. But if you're trying to time it around ovulation, every day, every other day should be good.
Well, can I say something about that?
Please.
We're animals. We're designed.
You're an animal.
I'm an animal, but you are too, by the way. We all are. We're designed to reproduce. They did a study a couple of years ago where they didn't they just asked the couples who were trying to have children to mark down where they were having intercourse. And at the same time, they were monitoring the patients to see the follicular growth. And they noticed that just around ovulation, spontaneously, there was more intercourse. And at the end of the day, we're all even wired to reproduce. There's fair hormones, that behavior changes. I think we put too much emphasis on when to have sex. We just live together, and you're pretty much doing the right thing. I've rarely seen people not getting pregnant because of lack of timing.
Yeah, there's underlying processes that are going on. Yes, we still recommend Bren 320 CBD oil. Obviously, if you're having any THC, marijuana, drugs and alcohol are not good for us at all. And so remove it if you can. Olivia, so much hello. How are you doing? DHEA extremely high. I do have PCOS. I am priming with Omnitrope and naltrexone. Is there anything else I can do to reduce inflammation? Fasting. 1 meal a day is my way to do it. 24 hours of fasting essentially every day reduces inflammation tremendously.
Especially in PCOS, because taking too much carbs increases insulin levels. We don't quite know why, but it messes up ovarian function. And increases androgen. So
the real cause, remember, glucose and glycation is the leading cause of most damage and disease. So if you're eating 3 meals a day, your glucose levels are higher. That damages the mitochondria of the ovaries and the testes and every cell of our body. So that's where I think it really is the biggest issue. And so, but Kiltz's keto lifestyle, low dose naltrexone, CBD oil, the inositol, and look at our female molecular fertility supplements. There's a lot of good stuff there, and Will's working to get it, so we have it available. Sorry, we haven't had it all the time, but and low-dose aspirin, even in some cases, low-dose steroids can be helpful and necessary. All right, let's see. Make sure we're getting all these questions answered. My mouse doesn't always work perfectly. Which CBD oil? We did have a CBD oil, and we're working on a new one again. But there are lots out there. Just make sure that the THC is low to none for sure. Let's see. Hello, T Sweet 05, Kayla, A Simmons. Hello, Mandy. Good morning, Becca. STEM day 4 going well and can't wait. We're looking forward to you guys in Syracuse. Our Albany team is amazing. Dr. Chang in Buffalo and Dr. Tezuza doing an awesome job. Let's see. Let's pick another question here.
I think I'm a special case, but I still can't get my body to a point where I can have my FET. My lining, my hormones now, I ovulate too early. I feel this is never going to happen for me. That's very, I understand your frustration. It's a very common feeling that you don't feel is ever going to happen to you, but it always does happen to you. We just have to work through the problems cycle after cycle. If we don't succeed, it's not a big deal because we can learn. It's a lesson. Nobody succeeds first time ever.
Don't
in
give
anything
up.
We do.
But
don't ever give up.
But so if you prematurely ovulate and it's a natural, even estrogen, get the antagonist or Lupron, and even a low-dose injectable cycle with a little letrozole, low-dose injectables, and a trigger shot may be another way to do this. Brittany, yes, you can request one of the doctors if they're in the office, whoever you want to do your transfer. If they're available, they'll be glad to come and do that for you. Well, let's see. Sona Muchton. Priming with Omnitrope was supposed to start my IVF with CNY, Colorado. Just found out I'm pregnant.
Oh, yeah.
Yes. Yes. Once you're pregnant, and talk to our team about immune protocol. Stay as keto as you can. Keto is the kick-ass, amazing game changer that I've learned in my life. I've seen it for so many. It's high fat, low to no carbs. In my opinion, that one meal, one snack, and if you can do without the snack, better. Do not feed your baby too much.
Greetings from Montreal.
All right. Hello,
Peganiki, yeah.
Hi. All right. Welcome. Recommendations for next steps after unilateral orchiectomy while the other testicle has microlithosis. Not sure about that, but I guess the question is why, but probably freeze some sperm and put it on ice if you still have sperm in the ejaculate. If you don't and you need to do a biopsy, put it on ice so that if you lose the other testicle for some reason, it's been stored. This is where I think keto, and look at oxalates, phytates, lectins, glutens are all deadly and damaging to our reproductive organs. Plants want to stop our reproduction.
There's a good question, Kelly Rolston Maxwell. Can I request HCG wash and intralipid infusion? What happened there? And PRP for my transfer. It helps so many having autoimmune issues. I'm working with inflammation, but I want to try all I can to help you get pregnant. Well, we routinely suggest HCG and intralipids. PRP
routinely helps implantation.
I don't do it routinely.
So our offerings are PRP, HCG, Neupogen wash, Sub-Q Neupogen, and Sub-Q HCG.
Don't forget embryo glue.
Right. Well, embryo glue is in the culture media for everyone. So it's not.
That's for every patient at CNY. Yeah, free.
You don't have to do an add-on on that, but things like intralipids, Lovenox, Plaquenil, and then the IVIG. But immunology is the cause, and everything we can do to reduce the inflammation.
And if you don't need it, we're not harming you. So that's the important thing too. That we're not doing anything that's actually going to have a negative effect and potentially have a positive effect.
So we don't know. So since since the cause of most of these problems we take care of is all inflammation, we want to reduce inflammation. All these things absolutely are a good add-on. Let's see. Stunning Riv. The hemoglobin A1C for transfer probably better than anything should be below 6, certainly below 5 is better. There's a marker. Plenty of women with higher hemoglobin A1Cs get pregnant, have babies. There are some higher risk of miscarriage and even potentially chromosomal abnormalities.
Birth defects.
Correct. But that's all related to glycation, high glucose environment. That's why a high plant-based, low-fat diet ultimately is a high sugar diet. And I recommend really reducing it as much as you can. But less than 5 is the best. Less than 6 is okay.
Yeah.
But again, it's individualized, not a global.
And I find that it's underrated, the negative effect of high blood sugar in pregnancies. I've had a lot of patients that simply were not getting pregnant, and we really tightened the sugar control.
Well, this is
and they got pregnant.
Well, this idea of tightened sugar control is another modern medical pharmaceutical. Remember, let's eat all day so we have your glucose the same.
No, that's not how you do it.
Which is really, but that's why it was a good comment.
Yeah.
Is that in truth, that's why fasting is like the most amazing thing you could ever do. Is it easy?
And the only way you can successfully fast is to eat high protein, high fat, because you'll not be able to fast otherwise.
Yeah, well, it's in essence, what I tell people is that high fat, because ultimately everyone's protein is about 20 to 30%, but we eat too many carbs, right?
No, carbs, no.
Carbs are killers. They call it carbocaine. Let's see. A consultation trying to decide if we should start at IVF or IUI, vasectomy reversal, and whatever average numbers we are dealing with agglutination and thick semen. IUI and IVF are all reasonable. Ginger's girl, for sure. It's up to you guys. Look at the price difference. Look at the options. But IUI is reasonable. IVF is reasonable. Don't forget. What do you think about endometriosis, Dr. Faruqi? Any comments on that?
That's a trap question. It's we could talk 2 hours about.
Well, let's do it in 1 minute.
Okay. Well, we don't even know what causes endometriosis, though. But
inflammation. Inflammation.
Let me finish.
Okay.
Yes,
I butt in on this guy all the time. Sorry about that.
So likely there is some dysregulation that occurs and allows implantation of endometrial tissue outside. The end result and the beginning result is all inflammation, and it messes up implantation. It causes infertility by damaging the tubes. So it is a very big player in infertility. Now, people who say they have silent endometriosis and come to us because they can't have babies, that's not silent.
It's not.
No.
Screaming at them, right?
Yeah. That is a very big symptom of infertility.
It is. And so I think that ultimately, if it's everyone said, well, idiopathic or unknown cause, you're infertile, that's not silent. The leading cause of infertility is inflammation. Endometriosis is just another list of the inflammatory findings. In my opinion, it's a de novo inflammatory environment that has nothing to do with the endometrial glands flowing around the body. It really is. It just happens to look like the endometrial glands, and we call it endometriosis. So I think it's really important that we look at it. But lots of home remedies. Look at our family building guide on Amazon. Download it. Get a paper copy. All the Western and Eastern philosophy. For me, Kiltz's carnivore keto is kick-ass the best. But for those vegans, vegetarians, or Mediterraneans, we're Mediterraneans essentially. That's where the one meal a day and add the fat. It's a game changer. I've seen so much benefit to that. But yeah, plenty. And don't forget, there's the male and female molecular fertility supplements. For again the female side and the male side.
Yeah.
And guys and women, get off the treadmill, cool the body down. Our bodies are too hot, and heat damages the DNA. And the snowballs cooling underwear for men, basically it's got a cool pack, ice pack, but get off the treadmill and cool the body down.
There's a good question right there. Melissa Leanne Mendoza, my HSG showed blocked tubes. How can I unblock my fallopian tubes? So your comments?
Well, if it's a proximal obstruction, it may simply be a tubal catheterization, but it's the same thing. It's there was a question about Claritin and migraines and headaches and things like that. So we take all these antihistamines and inflammatory products to reduce inflammation. Essentially, the fallopian tube is a very narrow channel. If there's swelling around it, just like a swelling we get in our nasal cavities, we can't breathe. Well, the tube will open if you reduce inflammation. That's where the antihistamine protocol, the antimicrobial protocol, and certainly keto is a game changer that will reduce inflammation, unblock the tubes, the selective tubal catheterization, and then also a laparoscopy. Sometimes at laparoscopy, you find just a little outside light adhesions that can be removed and the tube is open. Other times it's severe damage to the tube and they don't open very readily, do they?
So I think laparoscopy is a really good thing because it'll define what we could do about the blocked tubes or not. Generally, that's what we do. If you have blocked tube and we proceed with the laparoscopy, try to evaluate the degree of damage.
Let's see, Andrea. Let's see, dysbiosis. Dr. Endemy taking antibiotics. Do you think improving my gut health would impact the quality of eggs? Absolutely. Remember, the gut is the leading site of inflammation that gets everywhere in our body. Besides the antibiotics, I say you got to go Kiltz's keto and fasting. Fasting allows the gut to rest and repair. Dr. Verdialis loves to use that one, rest and repair. So Dr. V in Atlanta, thank you. But we need to rest our bowels. All the carbs and all the crap we put on our bodies is a killer. Eating fat is like soap, will help a lot. But I think the antibiotics, I use a lot of them, can be very, very helpful. We had another question on, I'm doing the diet, but I got less eggs this time. Brand me Nicola. It's quality of eggs, not the quantity of eggs. So there's ups and downs to everything. I got 20 last time, and this time I got 12. We see it all the time, no matter what your diet is. But I'd say still, I don't know what your diet is, though. But sometimes there may be other factors that are causing the inflammation before it gets better. But I think that don't stop if you're doing Kiltz's keto lifestyle or something similar, or look at Maria and Craig Emmerich. Get on their site, do a like and love, and buy their books. They're really, really great. Let's see.
Oh, here's a good question that keeps coming back all the time. Brittany Lake, we have 4 PGS normal embryos, but only one good grade. Do we have a good chance at one child?
What was your grade in school?
Actually, I don't want to say.
They were poor, and I was poorly graded in school. I'd say don't judge, don't grade. These grades you ask for, we give it to them. The embryologists look at it and they grade it, or they're trained to do that.
Yeah.
But embryos are always in motion. It's like you take 5 pictures of the same thing, and you look like this and this and this and all over the place. And so it's only a moment in a picture. In my opinion, all of them have an excellent chance.
And they keep contracting.
Moving
bigger and smaller. Depends where you take the picture. You look like crap. You look great. You look like crap. So grading is not the best thing. We have 4 normal embryos here, so there's a really good chance that you might.
But even the judgment of an embryo being normal or abnormal
is not that perfect.
Is very imperfect for sure. So we got to be careful on that one. Let's see. Patient of CMI Albany, no good eggs, 45, omnitrope, keto, omnitrope, LDN, CBD, fasting, and don't forget, consider donor eggs as an option. Low dose, mini dose protocols before you either get pregnant, deliver a baby, or it's time to move on, and be open to all options for sure. Praying. All of us have to have faith first. Fasting, faith and fasting are my foundations of life. Every day I do 1 meal a day, mostly. All right, preparing Samantha, frozen transfer, 5-6 for day 5-6 embryo. Go tomorrow to Monroe. I really hope you, Dr. Kiltz, or if I'm in Syracuse, I'll do it. We're working on getting Atlanta and Sarasota for retrievals and transfers sometime this year. So we're excited about that. Let's see. Missy Risley, I've had 6 transfers, all PG tested normal, and they do different. One miscarriage, one chemical.
So,
Dr. Faruqi.
so if I understand correctly, you've had 6 transfers of normal embryos and didn't get pregnant. I would start investigating. There's probably something else going on here.
Laparoscopy, hysteroscopy, do the antihistamine, the antimicrobial
ERA
protocol. And Kiltz is keto, ERA, ERP, endometrial biopsy for timing.
Receptiva. Well, I mean, laparoscopy would be better than Receptiva here.
Or it's part of the bucket, and then the other is a surrogate, a gestational carrier. So that's something we do.
Be like your last.
But it's an option if you have someone available, or it's like, hey, it's time. It's an option that we do at CNY fertility centers. So something for you to consider in this.
But this definitely calls for a workup here.
I think so. I think so. And the immune protocols go to the level 4, IVIG and Humira for sure. Let's see. Water, Christy O'Neill. I drink water when I'm thirsty. I don't like purposely just pound it down. Thirst is what I work towards. And although when you're hungry, I'm hungry all the time. And so you don't want to just eat every time you're hungry, because often, if you see food like me, I want to eat it. So I work to stay out of the kitchen, out of the lunchroom. And I have my habit of 1 meal a day at night. And then I rest and digest. And then throughout the day, my bowels are healing for sure. And again, just sync that 1 meal for me is at night. Kelly, hello. Panagrakis. Can we do a histamine antimicrobial protocol when we try naturally? Yes. Yes. So talk to the team. Hey, I'd like to get the antimicrobial antihistamine protocol. You could read about them in our family building guide on Amazon. We're going to talk about that in some videos coming up this week. Check it out. It's really great and helpful for everyone. And excited about Dr. Kondrup joining us in Sarasota. He's here in Syracuse for a month or two, and we're excited about that also. Pregnant, let's see. I was 6 weeks pregnant, was perfect.
Everything is perfect.
Okay, it's here. No, it was perfect. So these are the things, again, when we're learning about, everything looks perfect early on. Keto. Fasting is lasting, and a pregnancy will last longer when you fast more. If you look at many other organisms, fasting is the key. Go ahead, doctor.
Actually, very few animals, except the ones that graze on.
We're not herbivores.
Yeah, exactly.
We're not herbivores.
Because lions don't eat all day. We're carnivores.
So Maja Dalana talks about losing their pregnancy. There's so many pregnancy losses. That I think is one of the biggest problems, pregnancy losses. So, hey, I'm infertile. I'm not infertile. I get pregnant and miscarry. Often we don't approach that in the proper way, but essentially think of it as the same problems as if you're not getting pregnant. We've got to look at laparoscopy.
It's just a different area in the continuum.
Right. It's at a so it either egg and sperm are not getting together, or they're getting together and they're not implanting the embryo, or the embryo's implanting but not growing. There's so many parts of this.
It's in the same process. So here's a good question: endometrium versus generic progesterone for FET. Is there a big difference?
I don't think so. We use a ton of generic, and endometrium can be very expensive. If it's too expensive, please, hey, I want to get Prometrium or the generic progesterone vaginal suppositories. Prometrium can be used either vaginally or orally, and it's generic, by the way. So that I do know. Anything, let's see, Keto Drinks, Missy Risley. I don't recommend anything labeled keto. For me, it's got to be nature's natural foods.
The least modified food. Anything that's modified.
That's right. Yeah. So I mean, for me, I'll do we love French fries dipped in mayonnaise, fried in duck grease. Amazing. But it's a simple sugar, which I eat once a day. So really, to me, keto is a high fat, and then your protein and carbs. For me, it's high fat, medium to low protein, and low to no carbs, because high protein diets are deadly for our bodies also, by the way.
Two good questions right there. Taylor Jade Hansen, we have Frozen embryos, would we taught them to retest them for PGT? We've had 2 miscarriages. Well, that's a really...
You can, and we do. It's not unreasonable, but if you only have 1 or 2 left and you want to look at all the other causes, as Dr. Faruqi suggested, really got to look at all those other causes. What can I do to change the environment that my embryo is implanting?
Actually, if you're young like you guys are, and the more and more miscarriages you have, the less and less likely it's an abnormal embryo. There's something else going on.
But inflammation causes abnormal sperm, abnormal egg, abnormal embryo. So ultimately, even if you detect an abnormal embryo, it's still something going on in your body that caused the abnormal embryo. So that's why I think it's really, really important to look at Kiltz's keto lifestyle for fertility. It's the game change, in my opinion. What do you think about mosaic embryos, Dr. Faruqi?
It comes back to this whole testing. Number one, we don't test embryos. We keep saying we're testing embryos, but we're not testing embryos. We're testing the cells around the embryos, what later becomes the placenta. So we already know that up to 20% of abnormal, I'm not saying mosaic, abnormal embryos are normal. I would say about 40% of mosaic are normal. So we transfer mosaic all the time.
Yeah,
we have many pregnancies.
Normal children. Yes. ERA, endometrial scratch, good to do. Recommend them all the time. I do have 70-month twins via IVF, last transfer coming up this summer. Again, look at the Family Building Guide on Amazon. It really has a lot of good tips. Look at Kiltz's Keto Lifestyle on Amazon also. We have a new version coming out. Really excited about it. But it's all about fertility. Everything in our lives. If you're fertile, then you're more likely healthy in other areas of your life too. Let's see.
Oh, another good question. Will you transfer abnormal embryos? Come back to...
Yes, we do.
Yeah,
we do. Yes. Well, they're not our embryos. They're your embryos. We transfer infinite numbers of untested embryos. So if we've tested them and you have at least an awareness of what it means or doesn't mean, they're your embryos. You choose whether to transfer them or not. Nanu, recommend boosters. I'm not a big pusher on using the HCG boosters after either intercourse, IUI, or IVF, fresh or frozen transfer, but it's not unreasonable to do. Let's see. Ovarian PRP. Yes, we do ovarian PRP. If you're younger with the low AMH, it works better. Don't forget the ovarian bloom, which can help with your ovarian function, keto, LDN, CBD, and DHEA. Ask global team antibiotics and possible endometriosis. So the antimicrobial protocol, we're talking to the global team, and we have a great global team practitioners, and they're helping make all this happen for you guys. Let's see, Potter.
Good morning,
Clarissa, 1980. How you doing today? Welcome, and thank you to everyone from wherever you're coming in this globe, whatever you've been on this journey. We appreciate you sharing your energy to help us all do better. Hey, Cheryl D, how you doing? To Brandon and you, God bless you guys. Miss you. We're very excited about our Florida locations opening up, coming up later this year for sure. We do transfer abnormal embryos.
Do we transfer more than one embryo at a time?
Yeah. Individualized. Yes. These are decisions that we make with you in general. One embryo is recommended, occasionally two. Let's see. Uterine massage during stims. Talk to your uterus nicely. And yes, uterine massage is okay, but keep it light. Those ovaries are getting bigger. You got to be careful.
Well, this is a question that everybody's asking us. What about the vaccine, the COVID vaccine in pregnancy? Rob. Hello. No comment. Huh?
I think everyone should seriously consider getting the COVID vaccine pre-pregnancy, pre-treatment. Once you're pregnant, you got to talk to your OB doctor. And if you have significant comorbidities where the benefits of the vaccine are great, then I would say yes. But we don't have a long history of experience in taking it with pregnancy, so we don't know.
Yeah.
And we have to acknowledge our lack of knowledge in that, and you have to make the decision on your own.
But I would tend to tell my patients to perhaps avoid it at least in the first trimester, because that's where your baby is being formed. And since we have zero long-term history with this vaccine, at least take the baby out of the equation as much as you can.
Yeah.
So first trimester, maybe wait.
Let's see, Norjan Khan, 29. Let's see, tests okay. Husband is low morphology,
Probably.
motility.
Yeah.
AMH is good. This is where, again, if it's not happening, HSG, look at laparoscopy, hysteroscopy, ultrasound to check for fibroids, polyps, and look at our family building guide on Amazon. Really think it's important. A lot of really great stuff. Our Fertile Feast book.
Supplements for the husband too.
Yeah. So our molecular fertility male and female supplements, we highly recommend molecular fertility supplements. And both of you guys, this is both male and female always, even when the sperm is bad and the female side is good, or the vice versa.
It's still multifactorial.
Always multifactorial. And we have to remember that what we're doing here is making our bodies the most fertile that it can be. Sharon Gar, how you doing today?
Hello.
Let's see, Shah. Let's see, we're in Skinny Atlas, upstate New York, where I live, and Dr. Faruqi's hanging out with us. It's great healing energy, great, beautiful lake.
It's in the Finger Lakes in the central New York, gorgeous place.
So when you're visiting, you got to visit the lakes and get a chance to get out. Let's see, transfer 2 failed, going on 1. I'd be glad to shop. I'm in Syracuse Monday, Tuesday, Wednesday, Thursday. I'm in surgery. And this next week, Friday, Saturday, Sunday, I may be going down to check out the Sarasota location and see what we need to do to get it moving. Dr. Corley, Dr. Lutheringer around. We might have Dr. Faruqi come and help also. Let's see. Jessica, those supplements have improved his sperm. Great.
Yeah. So it actually really works.
It does.
It really works.
It does.
Because the number one cause for sperm problems, like the one earlier, is oxidative stress. These supplements have antioxidants. They have essential elements that help the sperm production, and they really do work.
And Colette, we're working on New York, and Jara, we're working on Virginia. We're working to make it as easy as possible for people to come to us from all over the globe. Affordability, quality access, but so many people get amazing help simply by listening and learning as we're discussing. We've had so many pregnancies simply Kiltz's keto lifestyle, fasting, look, low-dose aspirin, some of our supplements, and stay the course once you're pregnant, by the way.
And the no patient comes with an instruction manual. So when you come to see us,
you didn't? Okay.
He keeps changing his instructions.
I have to keep reading.
There's the most unpredictable guy I know. But patients don't come with instruction manuals. So we actually, we become a team, and we do things. We learn from our failures. We keep changing, and we continue at it. And almost always we succeed if we keep at it. The key word is keep at it.
Keep at it.
Keep at
it. Can I do transfer without progesterone suppositories and just progesterone oil?
Yeah.
Yoya 4612. Yes. There are many people that have a lot of inflammation due to these products in the vagina. So if you can't tolerate oral, the other is to add the prometrium or switch it oral along with the progesterone oil for sure.
And you need to know that the amount of progesterone we're giving you is probably multiples of what you really need. So we could give you less.
Yeah.
We could give different ways, and we're always on the money.
Hilani, first steps to begin keto, I think, is begin to Google it, read about it, listen to it. Go to Kiltz's Keto Lifestyle, The Fertile Feast, Maria and Craig Emmerich. There's so many people out there that I've learned from, and it's been a game changer for me personally. My bowel bleeding gone, arthritis, migraines, psoriasis, kidney stones, all gone. on this crazy concept. You can do keto and vegan, vegetarian, Mediterranean, pescatarian, paleotarian, and carnivarian. It's all possible, by the way.
There's a question about ovarian drilling here. Is ovarian drilling always done during a laparoscopy, and how long do you have to try again? Well, most of the time we do ovarian drilling. It's for people who have ovulation problems related to PCO. So we make little holes in the ovaries, and for some reason that we still don't completely understand, it gets the ovaries back to working for a period of time. I feel generally 6 months. Within the 6 months after ovarian drilling is the optimum time where you should be getting the benefits from the surgery. The other thing is that you might even want to consider the ovarian drilling and continue doing ovulation induction. So you do both.
I think it enhances for some people through IVF or frozen transfers. I think the ovarian acupuncture, I call it, is also helpful for sure. So ask the doc or the doc who's performing the procedure to look at the ovaries. If they are polycystic, 5 to 10 small thermal needle sticks will help. And Halani, yes to vegan. Kiltz is keto for sure. It's cook the carbs well, add coconut fat, coconut oil, and that I think is really a game changer, can be helpful. Let's see. Treated antibiotics for dysbiosis before doing the ERA test will change the results. I think you want to do the things to make your body the best, then do the ERA, then do the transfer once you've done that. So I think the antimicrobial, antihistamine protocol, maybe even the anti-endo. Remember, endometriosis can be treated either medically or surgically. So think about that for sure.
And many times we will treat the endometriosis for a month or two, then come back and do a transfer.
Yeah, that's absolutely.
And the pregnancy rates are much higher this way.
And lots of baby dust, Shah, that's for sure. DNC Friday night from first. Oh, and there's a question about at retrieval, if you do a scratch, can you do a fresh transfer? In general, we don't recommend that. Could you? You could. I don't know that we've done the study to see if it's just a simple scratch, not like a full DNC. It might help. No one knows that answer for sure.
Generally, we don't want to do experimental stuff like that.
But like anything else,
the best time to do a scratch is probably 7 to 10 days before your period, the cycle.
But we do scratches at retrieval, hysteroscopy, DNC scratch at retrieval for the transfer in the next cycle. Yeah. Which, so just so you know that we do that quite a bit as an option for you. Let's see, cramps during priming, Stella Licious, cramping, inflammation, all signs and symptoms. You're in the priming time. It's not unusual, especially if you're doing a little bit of estrogen with it. You may have a little bit more priming. Holly, normal to have shortened cycles after laparoscopy, hysteroscopy. Normal cycle. Currently on antimicrobial, antihistamine. When you add all these things and you're watching your cycle, there's going to be lots of changes for sure. There's lots of stress factors to all of this. Let's see. Melissa, thank you for your comments. We're grateful to you. Let's see. Samantha Montgomery, not a fan of needles doing the acupuncture, but I'm seeing my massage. Oh, by the way, acupuncture or massage or chiropractic or physical therapy or simply meditation, prayer, yoga, tai chi. Find the thing that resonates with you individually. That's really important, by the way. De-stressing. I think journaling, meditation, prayer are important. I think massage is as beneficial as acupuncture. And if you believe it, it's even more so, because our belief trumps every scientific study out there. Scientific studies are highly biased, highly prejudicial, and ultimately, if what you're doing is getting you in the right direction, then it's right. But if it's not, that's where it opens up to other things, by the way. Go ahead.
There's a good question there. What's the success rate of natural modified frozen embryo transfer using letrozole, HCG trigger, and progesterone? Basically, we're creating a menstrual cycle, an ovulation, and we're timing the transfer of the embryo with that particular cycle. It's pretty good.
It works.
actually.
So whether you're doing a natural cycle where you ovulate naturally and tell us when you have an ovulation surge, or you do a trigger shot, or you add Clomid or letrozole, or in some cases gonadotropins, by the way, or you're doing strictly estrogen and progesterone, all of these have about the same success rates.
The difference is in the monitoring. We're more likely to miss your ovulation, or the timing is a little bit more touchy when you're doing a natural cycle.
Yeah. But at all of our locations, we do all these things. And if you're finding someone says, "Oh, we know, don't do this," just say, "Well, is it possible I can do this, please?" And they will say yes. Some people may not be as open or understanding of what
But
we all
we
do
definitely do it
all the time.
as long as you're aware that you might be canceled because we missed the timing.
Yeah, but that happens even with estrogen and progesterone.
Yeah.
So I think, let's see, Holly Riddis, 26-day cycles, 37 years old, 2 chemicals, 2 miscarriages, HSG normal, supplements, keto lifestyle, don't want to do IUI or IVF. Root cause is found. Well, the root cause that you're looking for is already in front of our face, okay? You're looking for something that modern science in our methodology isn't very good at. It's inflammation. Inflammation is the leading cause of all disease. And so our treatments are actually covering these things, but it's egg, sperm, and embryo and implantation. It usually is in the treatment, we're covering these things more than anything. But I would keep what you're doing. If you haven't had a laparoscopy, hysteroscopy, get it done. But the world of fertility is rarely in identifying the cause, because the cause is inflammation. Whether it's tubal damage or sperm damage or egg damage, the treatment is either IUI or IVF, or natural conception, and keep having sex. But the things you're doing are really important.
That's a good question. Très beau, which in French means very beautiful. I did a laparoscopy and a hysteroscopy. They found my tubes were stuck to my ovaries. Now I've been told both my tubes are not in good shape. How would I proceed with IVF as the best option? Well, fixing tubes is not a very successful endeavor other than reversals. That is a good advice. We just need to make sure that your tubes don't have what's called hydrosalpinx, because that would actually adversely affect your chances of pregnancy and IVF. But if you don't have hydrosalpinx, then we could do IVF and leave the tubes there. And if you have nothing else wrong, that's pretty good chances of pregnancy going on here.
And then remove those tubes potentially if they're damaged, because they're the site of inflammation. So, we see so many people that have these chronic low-grade infections that either need long-term antibiotics, antifungal, and we're seeing bacteria and yeast and viruses all need to be treated, by the way, maybe for 30 to 60 days, along with removing those tubes, maybe a good way to proceed.
It's always touchy when you're going and doing a hysteroscopy and a laparoscopy and surgery, and now you got to talk to the patient before the surgery. I might be removing your tubes. A lot of people are very hesitant to do that. I've actually had to go back a second time and remove the tubes after we had a discussion.
Because they weren't removed the first time.
Yeah.
Let's see. Kayla, 5 days post-transfer, should I be having a period like cramps, nausea, and sore breasts, sexual intercourse after transfer of progesterone suppositories? You can have sex, but if you're having bleeding and cramping, I probably wouldn't. It may be all those suppositories in the vagina are causing a lot of those symptoms. The sore breasts and nausea are not so uncommon with the medications for sure. And it may be a sign of early pregnancy.
Exactly. Actually, a lot of our patients bleed after transfers with vaginal supplementation.
It's usually light spotting.
Yeah.
But if it's more than that,
then you need to get a hold of us.
No bleeding. So
but
the cramps are all that could be caused by the vaginal suppositories. And I'd probably say if you're having cramps, probably not have the intercourse. But we do recommend intercourse is okay, and it may be helpful also. By the way, how's everyone doing today? By the way, take a moment just to be grateful for this life we're all living and the experiences that we're living, even though they're very challenging. Gratitude will reduce cortisol and epinephrines and patience and love, and it'll get the oxytocin and serotonin juices coming up, by the way. So lots of humor. He's laughing at me all the time. And so I provide a lot of fodder for laughter every day in my life. Let's see. Love everyone. I love you. Let's see. Lose hope to have a baby anymore. Never, ever, 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 ever lose hope. Hope always. Have only positive energy is my little saying for having hope.
So your biggest enemy to prevent you from becoming pregnant is your mind. And your mind keeps telling you, you're not going to get pregnant.
It's your mind, not my mind.
Well, each one's mind is our own biggest enemy. Whether you want to have a baby or you want to have a business or whether you want to have any project, our mind is always working against us, telling us you're not going to succeed. And you have to overcome that, because that's the common trait that everybody who has a baby with fertility treatments, they overcome it.
I wrote a book called The Fertile Secret and my Living Your Best Life. And it really is, you have to imagine that God and having faith in God is always working in your favor, right? Because everything is favorable in your life. And the more you recognize that, the more you live with more joy every single day, even when these hard, difficult challenges are happening to you in your life. We all have some hard, difficult challenge in our lives.
When you really think about it, this whole journey is actually not even your story. It's the story of your baby. If this was a Hollywood movie, you're not the star of this movie. It's your baby, the star of this movie. The baby needs you to come to this world. So if you're feeling discouraged and all that, it's because you have to live the story of your baby that is coming to you. As long as you live that story, the baby is coming. And don't get discouraged.
And keep an eye. So it's always the dream of the baby, not the way it's supposed to happen. You have to let go of the way it's supposed to happen. Allow God to deliver it. And we appreciate all your amazing energy. And we're a family, the CNY Fertile team. And look at our Fertile Spirit website with Danielle, Fertile Hope Yoga with Aaron. Lots of offerings, lots of great support. Christine in Syracuse is offering some one-on-one counseling and discussion for those in our Syracuse office. And we're really, really, really appreciative of everyone.
And you can call anyone, you can set up a review with any one of us, just not even to talk about the medical issues, just talk about issues like this. We'd be happy to talk to you.
We all get frustrated, angry, sad, and mad, and we're here to listen and learn and do better.
We've been doing this for 30 years. We have seen with our own eyes what hope can do. And by the way, thank you very much for that comment, Kickers32. Don't lose hope. Listen to Dr. Kiltz and his team. Thank you for supporting.
Faith, always faith first. Let's see. Lee Shaw, DNC on Friday. First IVF in Michigan. She levels were 18,000 essentially. SAC only, no fetal pull. I have an appointment with you guys in July. No, it'll be fine. And if you download our family building guide on Amazon, you'll learn a lot. Leisha Ortiz, and through these things, Kiltz's keto lifestyle, I've seen so many people suddenly conceive and deliver a baby. But if that's still possible, maybe tubal ligation or something else. But we're gonna be able to get you moving forward. It takes about another month to get everything organized, but you have these options. And thanks to our Facebook support teams for all sorts of groups. Join the groups, listen and learn, connect, work on being more positive. We're all on this journey together with lots and lots of love in so many ways.
Oh, there's a good question. Well, it's not good. It's a comment. Kelly Panigirakis. It's very hard being a Brit, living away from home and being on this journey. Haven't seen my family for more than 2 years. Well, first of all, you need to know I'm a British citizen too. So CNY is also your family. You can talk to us. You can talk to any provider if you need support. You don't have to necessarily talk to us about protocols and things like that. There's people who call us all the time just wanting to talk with us. And you don't have to even specify. I just need to talk to a doctor. We'll talk with you. Same time, we could review your protocols and so on. You don't absolutely need your actual family, your friends and people around you, books.
And we're here to listen and learn together. But this is where these devices of connecting with people all around the globe. That's the fun, exciting part to this. A subchorionic hematoma is that is caused by inflammation. It's not the cause of a miscarriage. There's something underlying that, just like COVID virus is the cause of all the secondary side effects that are causing such damaging diseases and death. It really is anti-inflammatory, laparoscopy, hysteroscopy, antihistamine. Look at IVIG, Humira, Plaquenil, Neupogen, and Kiltz's keto lifestyle. And if you love to exercise, cool it down and slow it down. Whatever exercise you're doing, going for a walk in nature, do it that you could still have a conversation. You're not huffing and puffing, because when you're huffing and puffing, that means the oxygen is not getting to the microvascular and those individual cells. The reason we get so winded is because the oxygen delivery is diminished. So ultimately, the problem isn't the acetyl-CoA delivery to the cell. It's the oxygen delivery to the cell is our biggest problem. And inflammation reduces oxygen delivery. So reduce inflammation, increase oxygen delivery, which will then prevent the separation of the placenta from the uterus or endometrial lining. We're wrapping up here in a couple of minutes, and thank you very much.
An hour already, yeah?
Yeah, it's a zip time. Keep journaling, reading, listening, and learning from others. For me, pottery, painting, poetry, journaling. I hack my guitar. I'm bad at it, but I love just my 3 chords, and I sing pretty poorly, don't I?
Oh my God.
Oh, I was out visiting Dr. Maggs. He was playing the piano, and I was serenading him, and he was like, he quickly closed the piano and said, "Let's get out of here." But to our Colorado team, I'm really, really grateful.
They're doing really well.
They're doing amazing.
Yes,
there are bumps on all our roads, all of our roads. And when we learn to get in Dr. Mag's Hummer and raise the level of the car.
He's promised me to take me out in the desert with that car. I'm going to take his word on that one.
The antimicrobial protocol can be stopped once you do your trigger shot or your progesterone. Sometimes you might continue depending on what it was. How long, Kiana Ray, a positive pregnancy, do you suggest using Lovenox and Neupogen? At least to 12 weeks. Sometimes we'll go to 30. We'll go to 28 to 36.
It depends on your history.
Yes.
It's an individualized protocol at that point.
Ovarian bloom during stims. Yes.
Yeah. Actually, you should not stop that. You should be doing it until you get pregnant.
Yes, and then and stay on the molecular fertility female essentials, which is essentially our pre-pregnancy and pregnancy supplement. Let's see, S-Convic.
Yeah.
Right, making sure, just kind of sifting through some of these. Tubes are stuck to ovaries. We got that. Trimmy Tracy, baseline Friday, 2 follicles. I've seen 2 follicles make 1 or 2 eggs and 1 or 2 embryos and make a baby. So generally they should be growing in this. Be patient with the process. Bird bash. We got that. Good.
I think we got a lot of good questions today.
A lot of good questions today.
Yeah.
We're, again, thanks to Dr. Corley and Dr. Lutheringer for holding up the fort. Dr. Banerjee for coming out to Syracuse and helping.
And by the way, he's a really good cook. I heard that. He says he cooks real good Indian food.
And he's a great poet.
Yeah.
Dr. Banerjee's an amazing poet. I'm really, really, really excited about our whole team. Dr. Montalto, hoping coming and joining us in our Albany team, and excited about that. And to Dr. V in Atlanta, really grateful. Dr. Chang and Dr. D'Souza, so much and so many really great, amazing people out there. Grateful to everyone for continuing the connections, and everyone has really been amazing in so many things for all of us.
Yeah.
So again, we love you guys. We'll see you this week. Please say hi. If you want one of us to do your transfer retrieval, and we're there to do it, by the way. So again, God bless. We'll see you guys during the week. Don't forget, watch our other lives, YouTube, Instagram, Facebook. Don't check out our TikTok stuff. And I'm doing many more YouTube stuff. So go over to our YouTube channel, subscribe and like or hate if you want. It's okay. We want your input to all of this so we can all do better each and every day and each and every way for you guys. So we're praying. Lots of love. See you guys next week. Take care.
Take care now.
Bye-bye.